destination unknown as we're pulling for some gas. Officially placed a poster reveals a smile from the pack.
Dry drowning is not a real diagnosis. I'm going to say that again. It is not a real diagnosis. But drowning, that's very real. And that's what we need to understand. I'm Dr. Mona, a board-certified pediatrician and mom, and I make sense of viral health fears with the real practical tips you actually need. So hit that follow button if you haven't already. So where does this fear come from? Parents hear stories like this. My child swallowed water and died in their sleep 8 hours later. And now we're all terrified that every pool day will end in tragedy. But here's the truth. There is no condition where a child swallows water, acts totally fine, and then dies hours later without signs. That is not how drowning or the human body works. Let's talk about the real terminology for a second here. In the medical world, we use one term, drowning. It's an umbrella term, and there are only 3 outcomes. Fatal drowning, the person sadly dies. Non-fatal drowning with injury or illness. They survive, but they may have complications like aspiration pneumonia, lung injury, or rarely neurological damage. Non-fatal drowning without injury. They recover fully, no lasting issues. That's it. No dry, no secondary, just drowning with 3 possible outcomes. Now, what do people think dry drowning is? They imagine a child chokes on water, seems fine, goes to sleep, and suddenly stops breathing. That's not what's happening. Here's what can happen. Sometimes water briefly touches the airway and triggers something called a laryngospasm, a reflex where the vocal cords close off to protect the lungs. This can cause coughing, gagging, or even a moment of trouble breathing, but it resolves quickly, and it's not drowning, dry drowning, anything like that. Now, if water is inhaled into the lungs, it can cause irritation or inflammation, like aspiration pneumonitis or pneumonia. I have seen this, and so has my ER doctor husband, recently in fact. But that doesn't happen silently. You'll see symptoms within 4 to 8 hours. And here's what to watch for. Persistent coughing, fast or labored breathing, retractions or nasal flaring, vomiting, or your child just isn't acting like themselves. If you notice these signs, especially if your child struggled in the water, that's when you call your pediatrician or head to the ER. But if your child coughed up some water for a second and then was back to cannonballs and snack negotiations, they're fine. You can monitor them. So yes, drowning is real, but dry drowning is a phrase that fuels fear, not facts. If this helped clear things up, save it and send it to another parent who's heard the scary headlines.